Paget's disease of bone (PDB) is an musculoskeletal disease. Look at this picture, shows that normal leg, abnormal leg with Paget's disease of bone. Look at this. Bone scan and X-ray findings, skull, pelvis, knee joints, MRI and CT findings. Detail going on. Introduction. Paget's disease of bone is a chronic skeletal disorder characterized by abnormal bone remodeling leading to weakened, enlarged and deformed bone. First described by Sir James Paget in 1877. It is the second most common bone disorder after osteoporosis. The disease primarily affects the pelvis, skull, spine and long bones of the legs, though it can involve any bone in the body. Definition. Paget's disease of bone is a disorder of the normal bone remodeling process, where the bone destruction and bone formation, osteoplastic activity are uncoordinated. This leads to excessive bone turnover, resulting in the development of structurally abnormal, larger and weaker bone. Types. There are two types of Paget's disease of bone. One, monostotic, involves a single bone. 2, polyostotic, involves multiple bones. Which is the more common presentation? Causes. The exact cause of Paget's disease is unknown, but several factors may contribute. 1. Genetic factors. Mutations in genes like SQSTM1 are linked to familial cases of Paget's disease. 2. Environmental factors. Some studies suggest that certain viruses such as paramyxoviruses might trigger the disease. In genetically predisposed individuals, risk factors. 1. Age commonly affects individuals over 50 years. 2. Family history. A significant genetic components increases risk in those with a family history of Paget's disease. 3. Geography. It is more common in Europe, Australia and New Zealand. 4. Sex. Men are more frequently affected than women. Complications. 1. Fractures. Weakened bones are more prone to fractures. 2. Osteoarthritis. Joint damage occurs due to bone deformities near joints. 3. Hearing loss. When the skull is involved, compression of the auditory nerves can lead to hearing loss. 4. Bone sarcoma. A rare but severe complication where the abnormal bone may develop into bone cancer. 5. Heart failure. Increased blood flow to affected bones may put extra strain on the heart, especially in advanced disease. Pathophysiology. Paget's disease is marked by an imbalance in the normal bone remodeling process. It begins with an increase in osteoclastic activity, leading to accelerated bone resorption. The osteoblast responsible by laying down near bone rapidly, but this bone is disorganized and structurally weak. The abnormal bone lacks the compact, organized structure of healthy bone, leading to the formation of misshapen and fragile bone that is more susceptible to fractures and deformities. The pathophysiology of Paget's disease of bone involves abnormal bone remodeling, where the coordinated process of bone resorption and formation are disrupted. Below is a step-by-step breakdown of how this occurs. First step, initiation, excessive osteoclastic activity. 2. Compensatory increases in osteoplastic activity. 3. Formation of abnormal bone structure. 4. Increased vascularization. 5. Bone expansion and deformity. 6. Nerve compression and neurological effects. 7. Ongoing bone remodeling and dysregulation. This stepwise breakdown explains the abnormal bone metabolism that underlies the progression of Paget's disease of bone, leading to the characteristics, signs, and symptoms of the disorder. Signs and symptoms. 1. Bone pain. The most common symptom. 2. Bone deformities, including bowing of the legs, enlargement of the skull, and spinal curvature. 3. Fractures. Fragile bones are prone to breaks. 4. Neurological symptoms. Compression of nerves can lead to pain, numbness, or weakness, especially in the spine. 5. Hearing loss. If the disease affects the skull and auditory nerves. 6. Increased warmth over the bone due to increased vascularity in the affected bone. Diagnosis. 1. X-rays can show characteristics. Bone changes including bone thickening, deformities, and areas of overactive bone formation. 2. Bone scans help identify which bones are affected by the disease. 3. Blood test. Elevated levels of alkaline phosphate ALP are a key marker of Paget's disease. 4. Bones biopsy. Rarely needed but may help in cases where cancer is suspected. Nursing diagnosis. 1. Chronic pain related to bone deformities and fracture. 2. Impaired physical mobility due to skeletal abnormalities. 3. Risk for injury related to weakened bones and increased susceptibility to fractures. 4. Self-care defects related to deformities and functional impairments. 5. Disturbed body image due to visible bone deformities. Management aims to alleviate symptoms and prevent complications. 1. Medications. Bisphosphonates or reduced bone turnover. 2. Pain management. Analgesics for pain relief. 3. Physical therapy. Improve mobility and functions. 4. Surgical intervention for severe deformities or fractures. 5. Orthotic devices to provide support for bones affected by deformities. Treatment. 1. Pharmacological treatment. A. Bisphosphonates. First line treatment to reduce bone turnover and pain. B. Calcitonin, reduced bone resorption and can be used if bisphosphonates are contraindicated. C. Pain management. NSAIDs and analgesics to manage bone pain. 2. Surgical treatment. A. Fracture repair for managing Paget's related fractures. B. Joint replacement for osteoarthritis secondary to Paget's disease. C. Surgical correction of deformities in case of severe skeletal deformities. 3. Physical therapy helps improve mobility, strength and reduce the risk of fractures. Psychosocial medicine. 1. Body image disturbances. Patients may struggle with their appearance due to bone deformities, leading to low self-esteem. 2. Chronic pain. Consistent pain may affect the patient's quality of life, leading to depression or anxiety. 3. Support groups. Encouraging participation in support groups for patients with chronic skeletal disorders can be beneficial. Prevention. There is no known way to prevent Paget's disease of bone. However, early detection and treatment can prevent complications and help maintain quality of life. Preventive measures include 1. Early diagnosis and treatment. 2. Regular monitoring for complications. 3. Lifestyle modifications, healthy diet and exercise. In conclusion, Paget's disease of bone is a chronic skeletal disorder that leads to bone pain, deformities and fractures. Though its cause remains unclear, genetic and environmental factors are likely contributors. Early diagnosis, appropriate medical and surgical interventions, and supportive care are essential to manage the disease, improve mobility, and prevent complications. Thank you. Have a nice day.